You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with small diameter or mini dental implants. According to my first guest, he said nobody should be wearing a loose fitting denture. With us, we've had him on the program before. In fact, he's done more than 18,000 of these procedures, dental implants, over the years. Lots of experience, teaches other doctors how to do it. Dr. Benson Clark. Dr. Clark, welcome to the program.
It's a pleasure to be here.
Okay, good. Now, I know you brought some photos, so we'll bring as many, we'll try to show as many of those as possible. Now, for people that don't know your practice, who's the typical mini dental implant patient?
Well, Randy, there are people who don't have teeth, and there are people who have failing teeth.
Okay.
And they don't even realize that there is a solution, especially for people who have failing teeth. Okay. Number one, they're afraid, they may have a fear of going to the dentist. They may be embarrassed about it. They may think that they can't afford it. They may think of implants as being too expensive.
Okay.
But we have a solution for that. We have mini implants, small diameter implants that we can place in for a fraction of the cost.
Of regular implants?
Of regular implants.
Okay.
And not only that, for a fraction of the discomfort.
Okay.
Because we work right through the gums without flapping or exposing all of the bone. And it's a 8-minute procedure. And patients are in and out of the office with secure teeth.
Wow.
In no time.
Is it like getting your teeth back?
Oh my goodness, yes. It's like, I got to tell you a story.
Okay.
I got to tell you a story. Lady from Rochester, New York, flew into my office. I had treated her about 18 months before with a full set of implants and fixed teeth that don't move.
Okay.
She came through the door. There were 3 people sitting in the reception area, 3 patients. She came through the door, and I'm never in the front of my office, but some reason I was in the lobby. Well, in the office next to the lobby, in my assistant's room. She saw me, and she broke out and started crying. Immediately, I thought that she had a bad flight or that she had tripped and hurt herself. I left the area that I was in, went out to the reception area, and I grabbed her and I said, "Joan, what's wrong?" And she said, "You don't know how much you have meant to my life." She started crying. Now, I'm not used to that. But what happened, the 3 people who were waiting for their appointments stood up and applauded me in my own dental office.
Oh, that's nice.
It was the most unbelievable thing. I've never had that happen before. They applauded me. And I said, I've chosen the right profession.
Bizarre.
Yeah, I changed her life.
So is this the happiest group of patients? I mean, you take somebody with no teeth,
right?
You give them a brand new set of teeth supported by these mini implants.
Right. And this lady worked for the Rochester school system she was a high official in the Rochester school system. And she said it changed her life. She flew all those miles to see me. She had heard about me. But to be applauded by your other patients, a standing ovation. I played basketball in college. I'm used to that type of thing, but not from dental patients,
Okay.
That was unbelievable.
Now the dentures, back to the denture wearers a little moment. So you can actually give people either a snap in, snap out, or a brand new set of teeth that don't come in and out, supported by these small diameter mini implants.
But what I found is that most of my patients want teeth that don't move, that don't come out. They
so
want
the snap in, snap out you don't like.
Right. They don't like them. They don't want to be reminded that they don't have teeth. They want to think of themselves as, hey, I'm 19 again. And that's the way I want them to think. These are your teeth. These are not some teeth that you're buying and putting in your pocketbook or in your coat pocket. These are teeth that are in your mouth.
And they don't come out.
You're gonna die with those teeth in your mouth. You know what I mean? But you're gonna live a good life before you die.
Okay.
You're gonna live a good life before you die because you're gonna be able to eat. You're gonna be able to make love. You can be able to smile at your grandchildren. You're going to be able to walk down the street without having to put a hand over your mouth to laugh. You're going to be able to see your son's graduation, your daughter's graduation, and you're going to not be embarrassed. And that's something you can put. No, you cannot put a price on that.
Are there a lot of people that don't like their teeth?
Let me tell you, and we see them every day. They have a stiff upper lip. I call them the stiff upper lip people. They don't smile. The middle third of their face is just like they've been given Botox. They are frozen.
Okay.
Because they can't express themselves. When you can express yourself, you are human. That's the difference. Because a lower animal can't smile.
Right.
Zebras don't smile. Do you understand that?
Yeah.
And lions don't smile. Humans smile. That makes you human.
And there's a lot of people out there that don't smile.
Yeah,
you're saying.
because they're not. And we'll tell them, you're not a zebra. You're not a lion. You're a human. Humans smile.
You say this in your practice. They must laugh. I mean, you must have a good time there in your practice.
Well, yeah, I have a good time. But when I tell them that, I said that makes you different from a lower animal. Is that you can smile. That's the difference. And that makes you human. That makes you, when you speak to your grandchild, not your child, but when you speak to your because everybody loves their grandchild. Okay. When you speak to your grandchild, you show your love by smiling.
That's a good point.
And if you speak to your grandchild and your teeth are in the cupboard, you have a stern look on your face. And nobody wants that with their grandchild. They want to be happy with their grandchildren. And that's what this type of dentistry does. It makes people happy in front of their grandchildren.
So then, okay, look, how many denture wearers would you say there are where you are?
Oh my gosh, there must be 100,000 people who don't even realize that they can live a better life without having to spend.
So upper lower denture, like over 100,000.
Oh yeah.
So if it's so good then, to come in, get some mini implants to lock in a brand new set of teeth. Why aren't they all doing it? What's your take?
Well, Randy, they don't even know what's possible. They don't. First place, they've had fear of the dentist all their lives because that's how they've progressed to that point. So they have fear of the dentist. They don't know it's available. They think of the cost being much more than it really is, and denture wearers don't usually go to the dentist.
That's a good point.
So they think that this is the end result. This is what you do when you get older. No, you can look better. You don't have to look like you're finishing your life.
Yeah, but I know a couple of denture wearers. I know denture wearers, and they don't seem to complain. Are you saying there's no such thing as a happy denture wearer?
But they don't even realize how happy they can be. And if you don't know what you don't know, then you're not going to complain.
Okay.
Because these people, if you knew that you could wear teeth that, number one, would allow you to eat any kind of food that you wanted to eat, that would allow you to smile and never be embarrassed, to allow you never to put your hand up to your face to laugh, to allow you to kiss your wife or your husband without fear of something moving around, which would give you the confidence that you have been sorely missing for the last umpteen years. That's what implant dentistry can do.
So if these denture wearers knew how good it could be and how easy it could be, they would all come in.
They would all be in the office.
Not enough dentists to even take care of them all.
Right.
Really?
Yes. And we're looking forward to one day, long from here, where people will never have dentures.
Is that right?
Yeah, because it doesn't make any sense. With the technology we have today, with the knowledge that we have, it hasn't made sense since the early 50s, but it's been a slow process. Some people think that this is the natural way that you are supposed to age, and it's not.
So the future of dentistry is all dentures, the way we know them today, will at least be attached to something.
Everything should not be moving. Everything should be completely fixed. The only part of a car that fails would be the moving parts. The machine, the only part that fails is the moving part. That's anything that moves is prone to failure. So that's why people want things that are fixed.
Now we're talking in the green room, and I'm paraphrasing you slightly, but you're like an efficiency expert. After doing more than 18,000 of these, you can do, you said, what could take some dental offices 9 months, you can do in a few visits.
Yeah, it's.
Is it because of your system?
No.
What is it? Is it because of the small diameter mini implants?
It's because of this. Number one, the implants that we have today are so much more efficient.
Okay.
We have so much more research behind them. And the second thing is that the experiences that I've had placing 18,000 implants, we place an implant in between 6 and 8 minutes. That's all it takes. It doesn't take.
So you're fast.
Yeah, it doesn't take 4 hours, because if you're fast, the healing is better.
Okay.
You know, you don't have the tissue open, and you heal faster and less dramatically.
Are these people sedated or just numbed up?
It's just numbed up, and we can sedate you for those involved cases that we do, because I get a lot of referrals for extra problem cases. Cloudocranial dysostosis, osteogenesis imperfecta, those kind of cases.
I don't know what those
sometimes
mean, but they seem complicated.
Well, those kind of, we have always had those kind of cases come into our office. We are proud of that. But on a regular basis, everyday people coming into the office, they need to have their lives back. And you think that
but it's just teeth.
No.
What if somebody says just teeth?
No.
Because you're a dentist. Of course you think.
No. I hate to interrupt you.
Okay.
But let me tell you, it's not teeth. When you look at a person, you're looking at, because I'm a dentist, you're going to say, you changed their smile. No, I changed their eyes. The eyes is what you look at. You see the happiness in the eyes.
All right.
You follow me?
Yeah.
And when people are happy, their eyes explode with happiness. You can see it. You follow me? You can't fake
show me
a
one of
smile.
those photos over there.
Okay.
You brought some photos. Let's see these eyes. Okay.
This lady is from Latvia. Okay? She was sent to me by a dentist in London. Randy, I want you to look at this before.
Let's take a look.
This is her before.
All right.
Okay.
That's her smile?
That's the best. That's how she presented to my office. Her options were, she was told that she needed a denture. Why did she fly across the Atlantic Ocean to see me? It's not because I'm cute. She came because she wanted to keep 3 teeth. 3 teeth. And I asked her, I said, why not remove the teeth and let me place an all implant? She says, because it would make me feel old.
To have no teeth. Okay.
She said these 3 teeth.
So what'd you do?
We held on to those 3 teeth and supplemented them with implants and changed her life. We changed her hairdo. We changed her makeup. We changed her life.
Let's take a look.
And now you see her eyes. Her eyes are happy.
That's a good point.
Her eyes are happy. And that's what implant dentistry can do if it's done.
So those upper and lower teeth don't come out?
No.
And she would have been wearing a denture possibly?
Right.
Nice.
We changed her life. Actually, I'm saying the smile changed her life. We just facilitated it.
She looks like a completely different person.
Oh, yeah, and because she's so happy.
Okay.
She's a happy person. She comes into the office and lights up the office. Everybody wants to see her. She's a happy person. And she flies in, flies back.
Now, what if everybody from London finds out about what you're doing? They're all going to come out here, you'll be busy?
I doubt it, because there are capable dentists in London.
I got you.
It's just that, I gave some lectures overseas, and she had heard about me and everything. And
that's how they did it.
Yeah, that's how I did it. But she has been one of the greatest patients I've ever had,
Yeah, but and I say this respectfully. I have dentists, qualified dentists, that come on the program. They say, Randy, I don't like mini implants because they're too small and they fall out. They're just not there yet. What is your response to that?
Well, first of all, there was a study done recently and published where they followed 600 implants with a 94%, 600 small diameter implant patients with a 94% success rate.
Okay.
Now, the size of an implant has nothing to do with the failure rate. That's just bogus. The size of an implant has 0 to do with the failure rate. It's the placement in the correct position of the implant that makes all the difference, whether it's small diameter or large diameter.
Okay.
The small diameters are just less expensive and an easier implant to place. And patients who have fear of the dentist applaud this, because number one, it's easier to get them in the chair and easy to get them treated if they can see some success early.
Okay.
And that's what we do. That's why I like.
What about those people that have been wearing dentures like 20 years? Isn't it true you don't have enough bone to get this done?
Well, Randy, what I tell my patients is that if you can walk and talk, we can put an implant in your mouth. This lack of bone, not having enough bone, we can take care of that by placing the implant strategically or adding bone. That's just not an excuse not to have an implant.
Now you teach at 3 dental schools, right?
Yeah. I've taught at 3 dental schools.
Is that right? And you've lectured all over the world.
Yes.
On
yes.
this topic.
On this topic, yes. And I say with all the confidence, that 99% of the people walking around saying they can't get implants can get them.
Can do it.
Can do it.
And these are more affordable
Yes,
than the regular.
these are more affordable, they're faster, and it's just less invasive, which is a big deal for a person who has a fear.
Now we have to mention, because people do ask or email us, insurance. Even the best dental insurance doesn't cover this, the whole thing. Medicare, Medicaid doesn't cover this. So what's the answer?
We have a billing team that's built to help you get it financed through outside agencies. Number one, it's not as expensive as you think it is. And for those people who think it's too expensive, we have 3 people whose job is nothing to do but get them
financed.
Get you qualified and financed.
So you have to have okay credit.
Yeah.
But people are financing this routinely every day.
Right.
Okay.
Because Randy, it's the best investment that you can get. I mean, I may be biased, but to have a person to walk into their room, smile at their husband, to skip around, to look youthful, to change their clothes, to wear mini skirts at 40 years old, that's the kind of patient I love.
So it's their self-confidence that goes up.
It's the self-confidence thing. Let me tell you, when we fix their teeth, the first thing we notice is that they start dressing younger, they go to the gym, they walk with a little skip in their step.
Like a little swag.
Yeah, and the funny thing about this, which I cannot understand, I know this is weird, they changed pocketbooks.
What does that mean?
Well, I have no idea. Women come in with these new pocketbooks. This is a big deal. Apparently, they feel that, hey, I'm gonna splurge. I look good. I'm gonna get a nice pocketbook.
Is that right?
I notice that all the time. That's weird.
So this actually can be expensive because of the clothes you gotta buy and the new bag.
Yeah, they will buy that bag. I'm telling you.
Okay, now you brought some photos, and we're short on time. Now, for people just tuning in, we're talking about mini dental implants. No more dentures. So people that were told you need dentures, Dr. Clark says that in just a couple of visits, you get a brand new set of teeth supported by these mini dental implants.
By mini dental implants.
And if people have bad gums, the bleeding gums, the bad breath, the loose teeth, those people you can extract the teeth and give them brand new teeth.
Right.
With dental implants.
And it will change. The smile that you get will change your life. Number one, you're going to find that more people are going to speak to you as you walk down the street because you're going to be smiling. When you go into a restaurant, you're going to be seated at different tables.
They're going to put you near the front.
Yeah, I'm telling you, when you have a missing front tooth, you better believe you're never set in the front of a restaurant. They don't put you there.
It's a good point. We talked about it in the green room.
Yeah.
That in the movies, like in Hollywood, you want to make someone look poor, you give them bad teeth.
Absolutely. I'm glad you realized that because the first thing you do when you go to Hollywood, you don't get your hair fixed and you don't get your brows done. They send you to the dentist because they want that smile. That's only part of your face that we have so much control over is the smile.
Okay.
Yeah, it's the lower third of the face is where we live. You follow me?
Okay.
This is where our hearts are, in the lower third of the face. And that's the thing that separates us from the lower animals. That smile.
Because dogs can't smile.
Oh yeah.
Or
dogs can't smile. Cats can't even smile. But a human can smile. Once they get our implants in, they're going to smile.
Okay, good, good. Okay, so what are we looking at here?
This is a lady from Southern Maryland who presented to our office like that.
That was her smiling?
That was her presentation. This is a woman with dentinogenesis imperfecta. She was born without teeth.
Wow.
And she didn't have tooth buds, and the doctors that she had been going to could only do dentures for her. She didn't want a denture.
She heard about you, and then she heard about you.
She heard a lecture that I had given. Someone had come to a lecture I had given and told her to try me out. When she came to us, we said, the first day, I remember, I said, we can help you. She said, but, and I remember this, she said, I've gone to 11 dentists. I'm 57 years old, and none of them could do anything but make a better denture. I said, no, you're gonna have teeth that don't come out.
Okay.
We put teeth in her mouth that are fixed. She and her husband bought a new house.
This is very nice.
She moved to she moved to a new neighborhood, and she has a new house and a new life. I mean, that doesn't happen to her often. I don't think it had anything to do with the teeth, but her life just changed, and she wrote the nicest letter to our office, and I'll never forget her. You know, she still comes to our office. And she's the nicest lady.
So it's more than just teeth. I mean, if you don't like your smile, or you don't like your loose-fitting denture, this is like the second chance.
Oh yeah. When you have a loose-fitting denture, you don't like your husband, you don't like your grandchild, you don't like your dog, you don't like anyone because you always have a stern face.
Good point.
You know, if you want to show that you like someone, what is the first thing that you do?
You smile.
You smile. And if you can't smile, then you are a stern taskmaster. You are a person who has another agenda. You are almost a social reject, which no one wants to be. You follow me?
Yeah.
The person that you trust
Okay.
on your block is the guy who comes in or the female who comes in and gives you a smile when they meet you.
That's true. That's a good point.
Okay, now that's the person you trust. The person that you don't trust is the one who's always frowning. Think about the number of people who are nice people, but they can't show it.
They never smile.
They can't
Is it
smile.
usually, in your experience, because they're hiding something? They're ashamed of their teeth?
Well, it's because they don't know that they can smile, that someone can help them. You know,
Okay.
or either they're too embarrassed to ask, or they feel they don't have enough money. All of those things we can take care of.
Okay, you have more photos. We have time for one more.
You know, earlier I said that you can tell by the eyes, right?
Yeah.
This is a lady from Southeast Asia who came in. You look at her teeth, they were uneven, they were jagged on the end. She had an open bite where the teeth wouldn't even come together, that her tongue had to stay between her teeth. And then we said we were going to help her with her smile. And so in one afternoon, she comes in. We put these new teeth into her mouth, in the front of her mouth, that are fixed teeth, changed her
Appearance,
smile.
for sure. Wow.
Yeah. And if you look at her eyes, you see joyfulness.
Yeah,
You
true.
see her being joyful. Because let me tell you, we have a patient who's a friend of Oprah Winfrey's from Seattle, Washington. Now I'm in Alexandria, Virginia, but she's 90 years old. She flies out because I gave a lecture somewhere and she had heard about me. She flew in because she did not want a denture. So she wanted to come to me. Some other doctors had told her she was too old. And she said, no, I'm not, I'm 87.
But why would an 87-year-old want to do it?
Because she wants to eat and she wants to look sexy and she wants to smile. She has grandchildren and great-grandchildren. She wants to show love. Okay. So she came to me. We fixed her teeth, her remaining teeth, and we supplemented them with some implants.
Okay.
And so she went back to Seattle with this big smile. And so she has this smile, but she's determined to come back and get her teeth cleaned. So she started coming back every 6 months. And I said, wait a minute, you don't have to fly from Seattle, Washington to get your teeth cleaned. And she said, this smile has changed my life. They have a couple of schools named after her in Seattle, Washington.
Okay.
And they were having a celebration, and I flew out there for that.
Well,
and
that's nice.
she introduced me as her dentist, and it was unbelievable. It was
a nice story.
Yeah, it was an unbelievable experience. And that's what implants can do for you.
So no more dentures.
No more dentures, no more stern looks, no more unlovable people, no more people who have excuses for not having the best.
Do husband and wives do this together sometimes?
Well, they do it separately, but then they have to do it together because one will look really good and the other one will look really bad.
So what do they like more? What they can eat and chew?
No.
Or do they like the way it looks?
They
Or
love
both?
the way it looks because that's the thing that changes them in public.
But they can eat whatever they want to?
Yeah, they can eat
Like
whatever they
broccoli?
want to.
Like raw broccoli?
No. That's why fixed teeth are so good. They can eat whatever they want to. And the thing is, we find out that they lose weight, not gain weight, because they change their diet. They don't eat the soft, carbohydrate-filled foods. They eat more vegetables and things and fruit, things that they didn't eat before. They lose weight. They don't gain weight. They lose weight.
Do you hear a lot of eating stories?
Oh my goodness, yes. But I hear a lot of eating stories. But what I really hear is that my family is so happy for me. That's what I hear.
Because they seem happy.
Oh my goodness, yes. That's the thing that changes everything.
Well, this is
You got to
exciting.
understand that. You got to understand that. That's the thing that changes everything.
Okay, so we're out of time. Final message. Somebody watching this, they're one of the two main categories. They have bad teeth and they're going to end up in dentures, but they don't want dentures, or the denture wear.
Yeah.
What do you say to them? They've heard what you had to say, but for whatever reason, they're putting it off. Maybe they're afraid. What do you say?
What I say is, come in for a consultation so that you can see how easy it is to turn this whole thing around. It is not that difficult. It's very easy to do. It's not as dramatic as you think. And your life, what we find is that people get angry once they have the teeth in their mouth. They then say, I should have done this 30 years ago.
Okay.
Yeah. And I have no answer for that.
So everybody, and like you say, before they end up in your office, they usually hated their teeth for 10 or 20 years.
Yes.
So they missed out on good years.
They've had negative thoughts for 10 or 20 years. I can't eat this. I look this way. I have to laugh with my hand over my mouth. I can't go places. I can't throw my head back and laugh because I'm afraid my dentures will fall out. This type of thing. All of that is taken off their shoulders.
Good for you.
Because this is available. It's available. It's not some esoteric type of approach. It is a common approach that all we have to do is just get into the office. That's all you have to do.
Okay, good.
Okay.
Look, I want to thank you for coming on the show. Great stuff.
Well,
so it's a free consultation if they go to see you.
Oh yeah.
They get to meet you.
Oh yeah. Every time.
You're not too much of a big shot.
No. But I'm waiting for the next patient to give me a standing ovation.
Okay.
I told you I had that one.
You like that because of your basketball years in
Oh
college.
my goodness! I
with
had
all the
never
cheering.
a person crying out of happiness. Oh my goodness!
You like that? Okay.
Oh yeah.
Thanks again for coming on the program.
Well,
Good
listen,
stuff.
it's a real pleasure to be
Thank
here.
you for coming back.
Thank you.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.